So welcome everyone, and welcome to our Lunch and Learn, which is looking at how neurodiverse individuals can be their best self at work. I'm just going to run quickly through a couple of housekeeping rules. The first thing is that you'll notice that we're recording some elements of this presentation. So please just be mindful about that if you're asking questions, and I think we're going to switch off the Q&A, but just be mindful that we are recording it. We're in a Zoom meeting format, which will hopefully enable you to fully participate in the chat and discussion, but please do keep your mics and cameras off unless you're speaking, so we can hopefully ensure a smooth running order today. If you'd like to ask a question, please pop it in the chat bar and we'll come to that in the Q&A session of the Lunch and Learn. And if you want to ask a live question as well, during the Q&A session, please put up your digital hand with the reaction button there. I know I don't need to say this, but would just keep in mind to be kind and respectful when asking your questions or taking part in the discussion. This subject is something we've been exploring close to a year now, exploring neurodiversity in the profession, exploring what issues and opportunities there are. And that work has included workshops, surveys, tea room chats that I know a lot of you have attended, so it's really great to see some familiar faces. And that work's really revealed a range of experiences for a lot of our neurodiverse colleagues. And one recurring theme has been workplace adaptation and how we can all work together to make sure that everyone is welcome and working to their best self in the workplace. And so today we're really delighted to welcome Uta Langley, who is Head of Organisational Development at Historic England. And Uta is going to talk about her research and her work and also explore how we can support our neurodiverse colleagues in the workplace. So I'm going to hand over to Uta and listen to her presentation.
Well, thank you very much, Cara. I'm going to try to get rid of this little block. I hope you can all see the presentation. So the theme is how can neurodiverse individuals be at their best at work? And I just want to say the illustration have been all done by Daisy from Inky Thinking, and all the photography is from John Gay, which is one of the collections of the Historic England Archive. So let me start. Ding, ding. So what we cover in this session is sort of what is neurodiversity and how does it fit into diversity, disability, mental health and cognitive diversity as a sort of concept. Then we're going to break out into pairs where you can explore being at your best for yourself. And then we compare and contrast what you've been discussing to the findings from the research. And then in our last section, it's going to be about who has the power to make changes, and that's partially a part of the research, but I think that's when we then open up the conversations, if that's okay with you. So why did I undertake this research? So it was part of an MSc of People and Organizational Development at Roffey Park, which I've just completed in January. So I had two daughters who have been diagnosed with ADHD. The oldest, when she just started secondary school, which meant we were in Singapore then, it was like 7 times a day an opportunity to be somewhere at the wrong place at the wrong time with the wrong gear. And when we moved to Dubai, and when we looked for schools there, I said to them, yeah, my second daughter is fine. And as soon as I came back from that trip, I got called in by her school, where after 6 weeks, she hadn't done a single thing on a big project. So obviously, when I started talking to the doctors, I thought, this looks terribly familiar. So I was quite convinced I had it myself. But then I was moved internally in our office. So I had a little office with 3 other people, and there was the next office had another few people, and then there was one office that no one ever used. So we had that as a sort of room where we could go. And then all of a sudden I was in a room with 40 people, and I just couldn't cope. I walked in and I literally, my body went funny. I started being very grumpy and irritated when, you know, I found boxes on my desk or someone's coffee mug because I had hot desking. And people said to me, but you are the change queen, you know, you talk about change and you have all the tools. And I didn't know either until I sort of started researching. I'm just very noise sensitive, so I can't blend out noise. So when you walk into that big room, and it's all nicely done and it's a beautiful historic building, there's nothing wrong with that office per se, but on the right there is a big still archivist stuff, and then you walk through and then there's more stuff on the left and more stuff over there, and there are 40 people in it, and some people are really loud, and I found myself answering people's questions who were having meetings in these booths. And when I researched, I thought, well, I'm lucky, you know, I'm very clear that I'm extremely privileged, that in my position and my role, I could just say to my boss, look, I can't do this here. I'm just going to show up here once a week for meetings. Otherwise, I'm going to work from home. And I used to travel a lot to London pre-lockdown anyway. But I know that not many people are that privileged in their roles. So one of my motivation was, how can we make this easier for people to request things and to adapt so they can fully contribute. I was also aware from my position of people that sometimes non-performance or lack of well-being at work could be linked to neurodiversity, and it's often not recognized either by the person or their manager. And then as I started doing my research, there is actually really a threat to eliminate neurodiversity in the population through parental screening. Already, if you have ADHD, people wouldn't want your eggs. And as a German, this really scared me, just scared me as a topic. So what's neurodiversity? So it's a term coined by Judy Singer, who is an autistic social researcher in 1998. So it's a relatively modern or new concept, and it covers, as many of you probably know, several conditions that affect cognitive functioning, like autism, ADHD, Tourette syndrome. It is a concept, it's not a thing, and it aims to see conditions like that as variations in difference rather than a disorder, disability, or disease. And therefore it focuses on the strengths and contributions people with these conditions can make. And it's seen sort of similar to biodiversity or cultural diversity. And one of the things that shows up is that a lot of people don't see this as something they want to get rid of, but it's part of our identity. I wouldn't be who I am without my ADHD. And when I was young, people called me like the smallest nuclear power station, but I never knew why I had so much energy compared to others and why I couldn't, you know, sometimes just switch off. So cognitive functions that are affected are thinking, attention, memory, and impulse control. And the Wechsler Adult Intelligence Scale test measures things like verbal reasoning and so on. And how you know that there is someone who is neurodiverse is they will have a spiky profile versus someone who's more neurotypical, which is a sort of a phrase coined by the sort of neurodiverse movement. They will have a more flat, like a wave profile, like the orange profile is more neurotypical. So what that means is, yes, people with who are not neurodiverse can have problems with certain tasks and they have strengths and weaknesses. However, someone with a neurodiverse condition has extreme strengths and weaknesses. Yeah, so they are really good at something and really rubbish at something else. So some of the stuff comes easy to them, other things are impossible. So it is, however, it's recent and it's controversial because, you know, if you just see from that umbrella, there are so many conditions in them and each of the conditions is complex and often they are comorbid. So that means they come together. So you often have, especially women with ADHD, often have anxiety. So the question is, you know, which conditions do you include under neurodiversity? And the criticism is that only you can apply it only to high functioning individuals. Critics say that the concept of neurodiversity doesn't acknowledge the struggle and suffering of some people with these conditions. Also, the challenge is, and we had that conversation before with Amanda, Cara, and Alex, is that in the age range of, you know, like over the 40s, people often don't know they have the condition because they're not recognized. They're only recognized since the 1970s. So many will have it, they will struggle, but they don't know they have it, and therefore they will have an impact on, their own performance, but also on sometimes the team around it. And if it's not recognized, it's really difficult to do something about it. So how does it link with some other concepts? So the conditions are listed in the DSM. I always forget whether it's where all the mental health conditions are listed. They're also covered by the Equality Act as a disability. But obviously they're like about 70 to 90% of disability is invisible, and obviously all the neurodiverse conditions are invisible. Like all of these concepts, the challenges or the controversies are the same. It's about what's medical, what's socially constructed. I don't know if that is a term that you understand. If not, ask me later if that's something we want to explore further, what that actually means. There is an intersectionality topic where often you might have dyslexia and ADHD. If you get medication for ADHD, it won't help you with your dyslexia. The hints that you get for dyslexia will not help you with your ADHD. So you also might be a woman with ADHD or a woman with autism or a man with autism. It looks different. Then it's the big question, what's normal, and how do you treat deviances from the norm? So for example, the word normal only exists since the 1840s in the English language. Yeah, so what do we do with deviances? Do we need to cure them? Do we need to eradicate them? And this is where it becomes a very difficult conversation and not one we can go into now. However, people say, oh, with the DSM, are there new and more of these conditions, or do we create them? But there is a German children's book from it was published 1845 by Heinrich Hoffmann, who was a doctor. He called them funny stories. And when you read them, they describe people who are sensitive to touch, definitely an ADD person, someone with ADHD. And I don't know why they call them funny stories, because they end in humiliation, suffering, or death for the person with the condition. But what it shows is that these conditions are not new. They are just now more recognized and seen. So why does it matter for organization? So obviously, you probably are involved in the whole diversity debate. It's morally the right thing to do, to give everyone the chance to, contribute. And we want to include, all people in the working life. We also know that the organizations who have higher levels of diversity have higher levels of employee engagement, low absenteeism, and there is financial benefit. However, a lot of these benefits are can only be taken advantage of if you have beyond demographic diversity, cognitive diversity, meaning people who think differently. That is when you get better decision-making, better performance in uncertain and complex situations. But obviously that's much harder to attract, measure, enable, and maintain. Because what you find is that groups, by definition or by their dynamic, will lead to conformity rather than diversity. So how can neurodiversity help with this? So if you think that about 12 to 20% of people do have a neurodiverse condition, employing people with neurodiversity can help an organization understand their stakeholders and relate to them in a different way. So just think about written material. Yeah, if you look at neurodiversity and the stuff that organizations publish, a lot of it is very hard to read. For example, for people with neurodiversity, and understanding that will help. It will increase cognitive diversity, and it can also help attracting talent. And specifically in some industries, like if you just think big data, that could really be a fantastic field for some of the people with neurodiverse conditions. Is there discrimination? Yes. And I just want to say that some of used your research on dyslexia in this section of my dissertation, because you found that when people disclose their dyslexia, for example, they can experience discrimination, and that is also evidenced in other research, even on students. that, for example, people with dyslexia who declare it are seen as cheaters by both professors and their colleagues, which is really sad. So people, for example, with autism have a really hard time to get into employment, and the whole recruitment process is obviously stacked towards neurotypical people. Yeah, just imagine a journey. So first in the advert, it says, you should have excellent communication skills, even if it would be a job, for example, suited for someone with autism. You then have to read a lot of documents, probably go through terrible forms. You then have to travel to a different place, meet new people, shake hands, look them in the eye. So the whole thing is stacked again. And then you have to answer a lot of unexpected questions very fast. So it is really unlikely that even if you have the same talents, that if you have a neurodiverse condition, that you come out better than your neurotypical candidate. And that there is research that shows that. There's very little research on performance and promotions, but we know, for example, that 1% of managers is dyslexic, while the population has about 10% of dyslexics. Now, if you think of the office environment itself, it's a disabling environment for many people with neurodiversity, and I'll come to that. So what's the benefits for an organization? Well, we know that especially neurotypical people do bring difference in perspective, thinking, and experience that can lead to productivity gains, quality improvements, innovative capabilities, and employee engagement. So that's all can be proven. So my research was looking at how can neurodiverse individuals be at their best at work. So if you're a researcher, then these things may mean something. It's under the ontology of social constructivism, and the epistemology is interpretivism. I used action research because it's a participative democratic methodology, which is totally aligned with the motto of nothing about us without us. That's very strong in the neurodiverse movements. However, the results are individual and can't be generalized or universalized. So why I do these talks is also to see how does that fit with your experience should you have a neurodiverse condition. But also in the literature, it says if you have met one person with ADHD or autism, you have met exactly one person. And because of comorbidity, often it looks different. So in our household, we have 3 people with ADHD, but it looks different in each of us. So a lot of this has to be tailored to the individual. My organization did support the research, and it was an insider inquiry, and I had 4 sessions with 5 people. But it went quite deep. So what did I use as a model for being at your best? So I used the proxy and used well-being and performance, because both influence each other, but I thought they were a good model for being at your best. So if you can perform and you feel well, then that is likely that you are at your best. And this model is taken from Robert Dilt's logical models, but I've added task and role and line manager relationship. And now I'm gonna stop sharing for a minute. This is always very weird talking into the ether. So this is the sort of theoretical part so far. And now I would like us to explore that model for yourself. So I know that you've been sent a Word document where you can just explore and have a debate, and Alex will put you all into some pairs to have that conversation. When are you at your best? Because my aim is that I don't want these discussions to be just had with people who have a neurodiverse condition or their line managers, because that again can feel exclusive. But if everyone has this discussion, then it's becoming normal to say, when are you at your best and what do you need? And obviously, having just had the biggest experiment in an organizational life, we have all learned an enormous amount about ourselves. I'm not going to ask you to share any of this. what I want you to sort of be aware of is, how is your experience maybe the same or different of what I'm going to talk about from the research findings. And then at the end, we have some good time to just have an open conversation where we can all see each other. So even though my research question was a positive one, you know, how can we be at our best, I felt that I couldn't ignore quite a lot of the challenges that people with neurodiverse conditions face in the workplace. And also because some of this didn't show up in the literature. So obviously we can say, well, maybe that was just the 5 people you talked to. But I have to say, when I compared and contrasted what they told me, it did ring true. There's some, can you guys unmute yourselves, please? If that's possible. Thank you. Yeah, so some of this just rang true. So doing that research was actually quite hard and triggered quite a lot of my own stuff, I have to say. So the first thing I noticed is the price of turning up for some people with neurodiverse conditions is really high. So if you look at someone with, for example, anxiety and OCD, if you then throw something like body dysmorphia in it, getting up, deciding what to wear, can be excruciating for some people, because they project how they will be laughed at, that people will look at them, so they then change their mind. So that can take up time. Then they have to go around the house and check that everything is shut or off. Then they leave the house, then they panic and can't remember if they've done it. Then they go back. So by that time, you can just imagine the stress level that people have by that time. Then they go, if they're in London, or have to go to London or any other big town, the commute, where if you have anxiety, smelling someone's armpit, it's just really stressful. Then you show up in the office, and in the office, so some introverts, they will now feel much better understood, probably, because they go, oh my God, here are 40 people talking. Someone is eating. Someone is talking right next to me. The lighting is often really, really rubbish for many people. And so if you have dyslexia, for example, that can be really stressful. So by the time they sit at their desk, they have exerted a lot of their, energy reservoir already. What you also find is that, and I so had to laugh when we talked about this in the interviews, time management and productivity systems. So I couldn't even do star charts with my children, to be honest. They were very creatively produced, and after 2 days I had forgotten that we A, were doing them, B, what for, and if I had given anyone a star or not. Still today my kids can get me because I can't remember if I've given them pocket money. A lot of people had really challenges. So we create productivity systems that are so complicated that after 3 days you forget what pink stood for, and if that folder where you were supposed to put your emails in is what you thought it meant. So really real challenge for people. And obviously, as in your research, we found is disclosing or not disclosing will always be a question that someone with a neurodiverse condition will struggle with, and it obviously will be very closely linked to some of the issues around the shame and guilt I come to in a minute. But obviously, if you don't disclose, you can't ask for reasonable adjustments. Now, what I find is often people don't even know what to ask for, or they don't know what's available. Now, the other side is around why a lot of people who also in your profession will not show up as neurodiverse is because if you combine intelligence with neurodiversity, it often looks like average academic achievement. But again, the price to get to that average achievement will be very high. Yeah. So, but if you have someone who's intelligent, they will not often show up in school. They're doing okay. And what I found is with some of my volunteers, they got diagnosed at university. Yeah, where one of them said, their advisor went, look, you are so articulate, but when you write it down, it's rubbish. I can't understand it. And then they go, what's that about? The other thing is that I found is that a lot of people with neurodiversity have unrealistically high standards. They have sort of this illusion that all the other people are sort of perfect employees that are fully productive from 9 to 5, and are perfectly good with their time management and so on. So they constantly compare themselves with these high standards. You often find also that one of the signs that someone has in neurodiverse conditions is the gap between their intelligence, that, you know, for example, their environment knows, their parents know they're intelligent, but they don't achieve, and so therefore there's constantly this feeling put on them, you know, as children, probably by very well-meaning parents. You know, I've been there myself as a parent, that they should be achieving more. So they have constantly this feeling of not being good enough, and that leads to sort of shame, guilt, and overcompensating. So to the point where one of them asked me, should I work 50 hours a week despite the 36 I'm paid for because I have dyslexia, because I'm so slow in reading? Obviously the answer is no. But, you know, leadership is another issue that, or another theme that I don't think we have much research, is, you know, how does, when you have a neurodiverse condition and you become a leader, how does that challenge you? So, for example, I find that if I have staff members that need a lot of structure, I'm rubbish for them. If I have a staff member who is very happy to do their own thing and performs, I'm a fantastic leader for them. If you are very creative, like with some of the neurodiverse conditions, but you work with a very traditional team, there is a challenge. Yeah, but there's very little research on this. So, you know, if someone is a researcher, there we go. But when they are at their best, you know, what are the conditions? So one is, if you have a role that fits in with your strength, you have a much higher chance being at your best. And what I've found is, you know, so that if you have chosen a profession, let's say one of my people was an architect, which is fantastic if you're a visual thinker, but then now in their role, they have to write a lot of reports, which obviously, being dyslexic, really is challenging. Yeah. So if you have a neurodiverse condition, do what's called niching. That's one of the strategies. Yeah. Know what your strengths are and find a role that suits it. They have to know what good looks like. I mean, this is good for everybody. You know, I mean, I do leadership training. So one of the things is be clear in your expectations, but neurodiverse people need that even more so. And often very clear visual or written instructions. So, you know, long, vague emails, no use for anyone with dyslexia. They often, so the people in my research, so that may not be true for all, wanted to make a difference. They wanted to be of service, and often they connect to others either through sort of the network you provide, you know, or internally. If they can stand by their condition and talk about it, they have a higher chance of being at their best at work. And that often means they believe that they can disclose their condition and that they have a right to ask what they need. They also need to believe that it's okay to swap tasks and that it's beneficial to all. And for me, having been into sort of strengths-based management for a long time, it's a real challenge when you present that to managers, because they go, but that means people can cherry pick. And I go, yes, and that will mean they will be much better at it. But it's not a logical concept for many managers, because it goes against that everyone has to have the same stuff. So this means also that managers of neurodiverse people need to be more flexible. So skills they had when they were at their best were they were really aware of their strengths and weaknesses, and they would offer up their strengths. So they do what we call niche building. So Marcus Buckingham, who you know, from the Gallup Institute, who writes about strengths, has that also as one of their strategies. You know, and so it's like when you see, you know, a job around or someone asking for volunteers and it suits your strengths, you know, volunteer. And that way try, you know, you can try to expand the good stuff in your job and minimize the bad stuff. That's hard for you. And people use their strengths. So like if you have ADHD, you know, I can hyper focus if the deadline is there and I'm interested. There's quite a lot of visual thinkers, good problem solvers and creativity, and they knew they had that and used that in their job. they were able to set up and maintain simple systems for time management and productivity. They had some routines, and we talked earlier about lockdown. So what people found that for some people with neurodiverse conditions, lockdown was fantastic because they could, externalize their thinking, and they could organize their work better at home. It's easier to focus for many. But long term, it probably is that sometimes they need the buzz of the office, and ideally we allow people to do hybrid working in a very flexible manner. So if, for example, one day you have, I don't know, anxiety and you just can't face it, that it's totally okay to ring in and say, look, I can't do it today. But if the next day you need to do a certain task where you know that if you're on your own, you will procrastinate, but if you have some energy of other people around, then you go in the office. Asking for help, communicating was really important for people, and that lowered their anxiety. So if a dyslexic says, look, we're doing currently, we have a lot of casework and I might get the numbers of the cases wrong. So please, can you check to their colleagues that I've got the numbers wrong? That lowered their anxiety. And exercise was really important for several of the volunteers to just keep equilibrium. The environment is really an important measure to help people be at their best, and it needs to be flexible. People with neurodiverse conditions need to have space to be quiet and withdraw, but also to externalize. So externalize, I mean, several of the dyslexics told me that they walk about and talk out loud, and that then by the time they finish that talk, they could write it down because something changed in their brain. Others need like walls. I don't know if you can see my wall behind me. So I do a lot of mind maps. So that's externalizing thinking. And lighting is important for people, and often office lighting is really dire and gives people a headache to a point where they literally have to go home or can't work. Noise is an issue, and so someone with anxiety shared that, they loved it when in an open plan office they had a wall behind them, a window to one side, and a cabinet to the other, because their fear is that someone looks over their shoulder and looks at what they do and think they're crap. Yeah, and having that sort of boundary behind was really helping them. Line manager relationship is really important, that people have an empathetic, supportive line manager who understands neurodiversity and mental health, but also is able and willing to give clear expectations and constructive, honest feedback. So one of the concerns that went a bit like that. So if I disclose, then people will think I'm getting an easy ride. They think I'm making a fuss. They think I want to be treated differently, and they will not give me honest feedback. So there was a real fear that they wouldn't get honest feedback. And because they have already the fear of not being good enough, that then triggered more concerns. So that's what neurodiverse people need to be at their best, or at least the people I spoke to, and a lot of this made total sense for me. So we then come to the question, who has the power to introduce change in this? So I started with the assumption that, or the action research assumes that the power is within the person to make changes. And that was my assumption. What I realized is that despite all our efforts, Historic England, as many other organizations of similar size and spirit, let's put it that, are still quite hierarchical, and that takes a long time to change, so that people didn't perceive they had the power to adapt things. And the people with higher levels of seniority had a sense that they had more power. Yeah, so the question for me is, who needs to make these changes, and what can an individual do? What does a line manager need to do? What's the job of HR, and what's the job of the organization? And so where we are at the moment in Historic England is that we work a lot on awareness in order to hopefully then increase disclosure and increase people asking for reasonable adjustments. And obviously, with lockdown coming to an end and people most likely doing more hybrid working, and having had the experience of working from home for over a year, I think people will have a higher level of awareness what they need, but hopefully there is more flexibility to make that happen. Obviously, recruitment is a big thing to look at. So we started looking at, how can we make recruitment better for people with neurodiverse conditions. So I'm currently, I'm going to interview, or I'm going to advertise a role, and I want to make sure that they have the questions beforehand. If they thought about it, that doesn't bother me. I don't need people normally to come up with solutions in 5 minutes. So that's just something small, or to offer, even when people are back in the office, an interview over the Zoom rather than coming in. So that's a whole piece. And then obviously, how do we enable managers to be more flexible? And one of the big themes that came out of Google research, how teams work at their best, is to have a sense of to create psychological safety, because only then can differences be benefited from by the organization and the team, because normally groups go towards consensus, and people become more and more the same in their opinion. And we have to really work at creating difference and dissent in the workplace. So for me, that's one of my next topics that I want to put into training programs. Ta-da!